All right, guys. Welcome to episode 1 of eM-Dayspring. This is going to be a podcast that we're going to do on a hopefully somewhat regular basis to teach you guys about how to better use eMDs. And as promised, our first episode is going to be on ICD10. I'm your host, Dr. Matt, and my co-host is right here is Allison, and she's going to help us out. Say hi, Allison.
Hey, everybody.
All right. So we're going to talk about ICD-10, and we're going to do some live use of the ICD-10 coding tool to get you guys a little bit more used to how to do it, okay? So let's go ahead. Just as you guys remember, there are 4 types of coding linkages that can happen with ICD-10. A code could be auto-mapped. In other words, every time this code appears in ICD-9, there's automatically going to be a code placed in there that's ICD-10. You don't have to do anything. It's automatic. No work, nothing happens. Patient linked, in other words, once you code something for a patient and make the link between the patient's ICD-9 code and the patient's ICD-10 code, for that particular patient, it is always going to appear unless you delete it from the patient's list. There's the ICD-10 selection tool, where a bunch of codes that are in ICD-9 have ICD-10 options pre-listed for you, so you can make the selection really easy. And then, of course, if you can't find anything in those 3 options, you've got the ICD-10 search tool, which is going to allow you to go into the library and see if you can find a tool, find a code that's appropriate for your ICD-10 code. So here we go. Let's go ahead and take a look into eMDs and see what we got. And so remember, the charge capture portion of the chart is down on the bottom. You get there by hitting the little $sign, and that takes you right to it. So the first thing you'll notice about this, Allison, is that the 401.1, the central hypertension, already has an ICD-10 coded. This is a good example of an auto-mapped code. All plain hypertensive codes are automatically linked to the I-10 code. There's no more essential hypertension. There's no hypertension unspecified. There's no accelerated hypertension. They're all the same. The only exception for hypertension is if you see one that has related to kidney disease or heart disease, and those are very specific situations that we'll talk about in a future podcast if we get opportunity.
So I don't have to do anything to that one.
Don't have to do anything to that one. It's got a code underneath it. You go to the next one. That's absolutely right. Now for atrial fibrillation, you notice that there's already an ICD-10 code under this one as well. This code, I happen to know, is not auto-mapped. And so this code normally would not appear here. However, I've already seen Mickey Mouse for atrial fibrillation, and last time I saw him, I coded his atrial fibrillation as an ICD code of I48.2. And so now this one is patient linked. Forever forward, unless I change it, his atrial fibrillation is going to be linked to the chronic atrial fibrillation code in I48.2. So again, nothing to do on that one. You're already done.
What if you decide that was not the correct type of AFib you had and you wanted to change it?
All right, so if you wanted to change it under these circumstances, what you'll need to do is go into the ICD-10 coder, which is this button right up here. That opens up the ICD-10 selection tool. I want you to note that it's the ICD-9 specific code, specific tab that appears first. You have a problem list and you have a favorites, but the ICD-9 tab is the one that appears on top.
Okay. Yeah, mine always comes up as favorites first. So how do I get it to come up to ICD-9?
That's a great question. So if you want to change it so that the ICD-9 specific tab comes up first each time, you select Options, and you come down here and you can pick the ICD-9 specific tab and make sure the radio button is selected on that one and save it. That way, every time you open it up, that's the tab that's going to be on top. You can switch to favorites if you want to, and you can switch to problem list if you want to. Which actually has the patient's problem list on here and all the problems associated that way. But ICD-9 generally is the one you want to go to so you can find any ICD-9 specific linked codes.
That's a lot going on there.
That is a pretty busy screen. So one of the first things that I do is go ahead and use these buttons up here to minimize all of the options so I can get a slightly better look at what's going on. eMD says in the future they're planning on cleaning this up so it's a little easier to see, but for right now the best option is to minimize your codes so that you can just take a look at the main headers before you start looking at the ICD-10 options. The next thing you want to do is come over to your list over here, and again, we check hypertension. That's already coded, so we don't need to worry about that. We also see our preventative health counseling. Again, this one is auto-mapped, and it's always going to be linked to something. You don't need to add anything to it. You don't need to subtract anything to it. This is the one that we automatically drop for every patient that allows us to address are particular health maintenance problems for that patient. And so we're going to leave that one alone. We're not going to worry about it. But you asked what happens if you decide that his chronic atrial fibrillation is actually paroxysmal atrial fibrillation. Well, the first thing you want to do is you want to go ahead and highlight it. You want to make sure it's light blue so it goes under that code. You can actually select atrial fibrillation even if I'm not highlighting that one, and it's going to go under the wrong ICD-9 code. So you want to make sure all the time that you've got the light blue over here on the left-hand side. Once you select that, now you've got your options. You can see that chronic atrial fibrillation is selected over here, but if you say, nah, it's actually really paroxysmal because now we've discovered that it's actually coming and going, all you do is unselect chronic and select paroxysmal, and now this one is going to be coded for this visit and should be coded for every visit forward at this point until you change it again.
Gotcha. What if I think I accidentally put that under essential hypertension earlier today? What do I do then?
Okay, so say that we're under here and we're moving pretty quickly and we accidentally select it right there. Even if we go out and save it and we get out here and we notice, oh man, I put that under the wrong thing. That is definitely not atrial fibrillation code right there. You can go back into the ICD-10 coder and then you just hit this little delete button right next to it and that removes it.
That's easy.
That's very easy. Now, sadly, if you go ahead and close and sign off the note with those codes on there, there is no way to delete it. But again, when you go ahead and create that note for a future visit, you'll be able to delete it, and that should take it out of the auto link for that patient. So once you're done on this screen there, you go ahead and hit the save, and then once you're done this patient, basically you can check out. You've got an ICD-10 for every ICD-9, and you can go ahead and check out by hitting the little clipboard with the green check on it. You'll notice that you actually get another chance to review to make sure that you've got an ICD-9, 10, 9, 10, 9, 10. There's one for each of those, and so you can save, and away you go. And then you would do your normal E&M coding just like you normally would under those circumstances.
Now, what if for some reason I went ahead and accidentally saved and checked out the note and completely forgot to do my ICD-10 coding? Can I go back and do it later?
You can go back and do it later, and not only that, but once we go live with ICD-10 in October 1st, there'll be a warning that will pop up that'll let you know, hey, you didn't put an ICD-10 code in there. You will be able to override that if you need to, because there are just a few rare circumstances where there are a few ICD-9 codes that we don't code into 10. One example, I have some specialty nursing home codes that we don't actually bill for, so you would skip those. But it will give you a warning so that when you don't, or if you forget to, or if you miss one, it'll say, hey, you intended to go ahead and code this. You need to go check it out. So, all right, let's go on to our next patient. That's Mr. Mortimer here. Mortimer has a similar situation. Except for here, you'll notice that his hypertension, again, auto-mapped, going to appear for every single patient that you do. And here's our preventative health maintenance code. And again, it's already got a 10 associated with it and always will. But if you notice, atrial fibrillation doesn't. And that's because
it is patient linked, right?
It's patient linked only. So we have not seen Mortimer for AFib yet. And so we're going to have to choose a code for him to be able to patient link it. You also notice that type 2 diabetes also doesn't have a code, and that's because type 2 diabetes has too many selections to be able to auto-map it. Just don't know what particular complications a patient's going to have. So so now you need to put those codes in. Where do you go?
The button.
Absolutely, right to the ICD-10 coding button, and that's going to go ahead and bring up our options. Again, I'm going to make sure I'm under the ICD-9 specific tab, and this is way too busy, so I'm going to go ahead and get rid of the minimize this tree. That way I can look at my different conditions and see what's going on there. So the first thing I'm going to do is look down my list here, and it looks like I need to pick two codes. I need to pick atrial fibrillation, and I need to pick type 2 diabetes. So I'm going to start with AFib, and I'm going to make sure it's light blue highlighted. And then I'm going to kind of scan down here and see where the atrial fibrillation is. And boom, there it is right there. And I'm going to open those two so I can take a look at what my options are. Again, as long as it's documented in the note, it doesn't matter what the number is and it doesn't matter what the description is. So in other words, if this says plain atrial fibrillation, or even if this says chronic fibrillation, but in your note where you documented it said this is paroxysmal, you're going to want to pick paroxysmal under those circumstances.
And my note is in the plan?
As in your assessment, plan, HPI, it just has to say it somewhere. And one of the things that we'll go over is that we are going to enhance the templates to make sure those options are there for you. Actually, in our AFib template now, there's an option to go ahead and choose chronic versus acute versus paroxysmal, and it actually has the cardiology definitions of all those built in there, so you can use that as clinical decision support to help you make your decision. The next one, next one is hypertension. We don't need to do anything with that. That's already coded. We don't need to go there. And the next one is diabetes. So we need to code our diabetes. So we're going to close up the AFib so not to kind of gum things up. And we're going to open up diabetes. We don't necessarily need to open all of these. Some of these are going to have different options. They're actually linked to the description, not to the number. And that's why we're seeing duplicates like we do. Again, eMDs is going to work on some things to clean that up, but they wanted to make sure that the ICD-10 codes matched as closely as possible the descriptions rather than the actual number in there.
So now, under the ICD-10, is there well-controlled and poorly controlled still?
So ICD-10 did away with well-controlled and poorly controlled, and there is not an option to put that in there. There is only type 1 and type 2. And there is an extra code that we'll use that we'll take a look at to distinguish whether the patient's on insulin or not, and that's actually right here. So if the patient's on insulin, you select it. If the patient's not on insulin, you don't want to select it. And that's here. There's also a reminder that we'll get once we're done coding that will allow us to add on that code if we need to do so.
Can I put more than one code, or?
You can put more than one code. So you wouldn't want to put contradictory codes. And so in other words, if you selected E11.9, which is diabetes without complications, then you certainly wouldn't want to put that they have a retinopathy or a nephropathy or something like that. That being said, the correct way to code a diagnosis, if the patient had type 2 diabetes with a kidney disease, you would select nephropathy. And then if they also had nerve damage, then you would select neuropathy as well. You'd actually select as many of those as apply appropriate to the patient's situation.
So you said these are patient linked, right?
And now these will be patient linked. So once you do it the first time, that'll pull forward each and every time as long as you use that type 2 diabetes descriptor.
So if my patient does not have complications, but later he develops diabetic neuropathy, what do I do?
You would go ahead and you would delete the non-complicated. So if we had a patient that says no complications, when you go to make that coding situation, you would go ahead and delete that one, and you'd add that they've developed neuropathy by putting the diabetic neuropathy code. Another option would be is if you wanted to code a situation where the patient had diabetes and you were addressing that, but you also addressed their neuropathy and you did so under a different assessment by using the ICD-9 code for diabetes with neuropathy, you could actually put an ICD-10 code twice in the note. And so once under the diabetes and then once under the neuropathy. And in the future podcast, we'll look at a situation when we get into more specific coding on diabetes. So now that we've got a code under each one, we're done. So we go ahead and hit save. And again, we check. We've got an ICD-9 for each ICD-10, and we're done. Again, I think for this first 6 months to a year, I think the most important thing is to make sure you have at least one code underneath there. If there are some obvious examples where it's appropriate to put more than one code, you go ahead and do that, or some specific examples that we'll talk about, one of them being like the insulin that's listed under the type 2 diabetes. As we get more sophisticated with this and as we learn the codes a little bit better, we'll get into coding 2, 3, sometimes 4 things under each one as is appropriate. So, all right, and again, you would just check out using your clipboard and you go from there. Next patient we're going to look at is Micro, and Micro is an example of an acute visit. He comes in with foot pain and elbow sprain. So this is going to be something that the mid-levels particularly are going to see. And it's going to give us an example of using the search tool. Because as you see, again, preventative care is auto-mapped, but the other two don't have an option. And if we open up the ICD-10 button, here we notice that while someone has already coded a left foot, there's actually no code for right foot put in the ICD-9 specific to. Now, interesting enough, once we do this and add it to this code, next time someone else has right foot pain, there'll be the option to select that. So this is a smart tool in the sense that it's going to grow as we use it, the more options that will be linked and available for us to use in the future.
So even if it's a different patient?
Even if it's a different patient. So it won't be mapped to...
Sorry.
No, it won't be mapped to the patient if it's the different code, but it will be available for you to choose. So under foot pain, eventually, once we get all the codes in there, there'll be a right foot pain, a left foot pain, and a bilateral foot pain.
Okay. What if it gets too bogged down and there's a bunch of crazy diagnoses in there? Can I get rid of some of them so I can see it better?
Not right now. So at eMDs, again, is working on the option to go ahead and edit these, and I'll have the ability to do that in the future. But right now, if a code gets accidentally linked to the wrong diagnosis in this ICD-9 specific tool, then we kind of have to deal with it and ignore it right there. Again, you always have the option to minimize it, but or maximize it as you go. But unfortunately, once something's stuck in here, we're kind of stuck with it for now.